Hi, I'm Kaylee and I had vestibular case A with a 55-year-old female. Two diagnoses I think my patient might have is Meniere's disease and persistent postural preceptual dizziness, or 3PD. I was thinking Meniere's disease based on the history of hearing loss, mild ringing in her ears, and vertigo lasting for hours. And then I was also thinking 3PD just from maybe the history of vertigo being a trigger, and also having a chronic sensation of this dizziness that started about 3 years ago, and then also maybe having a triggering event of just the world moving around her. After looking at the test results and the outcome measures, I think my patient is having attacks of Meniere's disease, probably in the right ear, just based off of the hit result. And maybe she's just now coming into the clinic after an attack. She did say that she had about 4 episodes of this ringing in her ears and the vertigo, so this could maybe be attacks. And I think it's also Meniere's disease, because after having an attack, patients can feel clumsiness, fatigue, unsteady, and have these visual difficulties of like bouncing and watching movements, which she's complaining about the bouncing visual difficulties while she's walking and running, and then also having the VOR difficulties. I don't think it's 3PD anymore, just due to her not having any symptoms, or her symptoms getting worse with postural changes or head and body movements, and also not having symptoms in like complex environments like the grocery store, or her reading or looking at the computer. Also with 3PD patients, though, may show high anxiety, and she's not really showing any of this. So with a summary of her test results, she's not showing any signs of central problem. This is just due to having a negative HINTS plus, which is just the hit impulse test, nystagmus, testing for skew, and hearing loss. So she does have an abnormal hit test, but other than that, she's just showing, or she had hearing loss in the past, but this does not count as central problems. She also doesn't show any signs of BPPV, just due to the Dix-Hallpike and the roll test being negative. She does have VOR issues, just with having a positive hit test, and also abnormal 4-line differences with the DVA. She is also in the moderate level of DHA or DHI with 52%. She is not a fall risk due to having 18 seconds on her tug. And then also for the mini cat sib, she lost her balance or had a slight sway with conditions 2 and 4, and then she also had a sway with eyes closed with the sharpened Romberg. So before my first treatment session, I would first refer my patient to an ear, nose, and throat doctor to be tested for Meniere's disease first off, and then either if she has Meniere's disease or not, she can come back and we can just treat her symptoms that she is showing firsthand. With Meniere's disease, a lot of patients will have unilateral vestibular hypofunction, or UVH. I would base my treatment off of the first 20 minutes just being gaze stability, and I would show her the intervention of ×1 just by writing a letter on a sticky note and putting it on the wall about arm's length in front of her. I would have her fix her vision on this letter and just have her shake her head back and forth at a comfortable speed. I will just educate her on her symptoms may be provoked, but we want to try to fight through these symptoms because it's better for her in the long run. But if her symptoms get too much for her to handle, we can take a break. And then the next 20 minutes of the session, I would do some exercise based off of balance training. So the first exercise I came up with was based on her mini cat Sib. She lost her balance during conditions 2 and 4, and this is when she had her eyes closed. So I would just put her in the parallel bar with her feet together, and I would do multiple sets of having her eyes closed. She can use a couple of her fingers just to add proprioception along the way. So I would have her close her eyes for 15 seconds and then open them, and then we'll repeat this for a total of 5 sets. And then the next exercise I would have her do is just standing with her feet shoulder width apart, and then I would just have her looking from one side of the room to the next side of the room at a comfortable speed, and I would have her do these head turns for about a minute, take a break, and we would repeat this for a total of 3 sets. This exercise is based off of her VOR issues and also just her feeling like the world is moving around her while she's walking or running. And then the last exercise is based off of her Sharpen Romberg, which she had trouble with her eyes closed. So I would just modify it by her doing a modified Romberg. She would have her eyes closed for 10 seconds, take a break, and we would do this for a total of 5 sets. And then the last 20 minutes of our session would just be based off of patient education and her home exercise program. So I would just educate her on what PT can do for Meniere's disease, and also we will look out for acute attacks, just due to we don't want to do treatment during these attacks. And then I would also recommend doing a no cats diet, which is just avoiding caffeine, alcohol, and tobacco, and then also doing a low salt diet. And then for her home exercise program, I would be doing this gaze stability, and she is more chronic based off of the 3 years of symptoms. So we would do this gaze stability for 20 minutes a day, every day for the next 4 to 6 weeks. And instead of the sticky note, I would just have her fixate on her thumb out in front of her and then shaking her head back and forth. And this includes the first session. Thank you.